Good morning. My name is Allison Thurman. I'm a senior level nursing student at William Carey University, and today I'll be performing NG tube insertion and removal. And we're going to talk about feeding and suctioning and all that. Okay, so the first thing I'm going to do is check my orders. I'm going to go ahead and go into the patient's room. Hi, can I see your armband? Can you tell me your name? All right, Miss Barbara. So today we're going to do an NG tube. So I'm going to go ahead and wash my hands. And put on a clean pair of gloves. And if Miss Barbara could drink, I'll go ahead and give her some ice water and let her hold that cup. So I'm going to open up. This is Salem Sump NG tube. Go ahead and open this up and get my tube out. So this is it. And what we're going to do is measure the 3 tips. We'll pretend like we're doing it on this Barbara, but I'll do it on me so I can demonstrate. You're going to measure from the tip of the nose to the tip of the ear and then to the tip of the sternum. Okay, and then we're going to mark right where it is with a piece of tape. I got some tape right here. So we're just past 50, about 53. So you can either mark it with tape or remember the number, but the tape will be easier. All right, so we got this. I'm just curl it a little bit around my hand. That makes it a little bit easier to go down. And then let me see, I'm gonna get some lube. Okay. All right, and then we're gonna take the tip and make sure it's good and lubricate it. Get this in. All right, Miss Barbara. Tell me which nostril is easier for you to breathe out of. Okay, that one is? Okay, so we'll put the tube in this one. Okay. All right, so it's going to be a little bit uncomfortable. You're going to feel a couple, like a good bit of discomfort, but we're just going to start putting it in. All right, dear, now go ahead and put your chin to your chest and start swallowing for me. And just swallow, swallow, swallow. Keep on swallowing. Okay, we're almost there. So we're at the 50 now. And I'm just going to take this to your cheek for now, just to hold it in place. All right. Okay, so then I'm going to put my piston syringe. Oh gosh, hair. Okay, so we're just going to leave this in place. Okay, and I'm going to aspirate a little bit of gastric juice and put it on this pH testing strip. And it's turning like a dark yellow, orangey color. So that means it's about 3.5, like normal gastric contents. But we're going to wait on the chest x-ray to make sure it's in the right spot. Okay, the chest x-ray is done. It's in the right spot. We can start using it. Depending on what it's for, whether it's suction, whether we're suctioning out, or if we're doing feedings, that's important. You just want to go by your doctor's orders. I'm going to go ahead and put a real piece of tape it down good. My little bridge in my pants. Okay. Just go on your nose. And we're going to wrap this around here. All right, and so let's say she's getting a feeding. There's different types of feedings that you can do. You can do it like by gravity and just hook it up to some feeding and let it flow in at its own rate. Or we can do like a bolus feeding. And I've seen it a couple ways. You can draw it out of the can or the bottle with the syringe and then push it down into the feeding, or you can, I've seen people pop this off and just hold it like this and then pour it in. That's like gravity going in. But before any feeding, you always want to aspirate your stomach contents. And depending on your facility, if it's greater than 300, 500, depends, you want to hold the feeding. But if it's not over one of those numbers, you want to put all the GI residual that you got out, put it back in, because they need that. Okay, and so once you do your feeding, you always want to flush in between. And if you're doing meds, you want to flush in between each individual medication. Usually with about 30 mils, but 15 in between each medication. Okay. So we're done with our feeding. And so now it's time to take your NG tube out. Okay. So I'm just going to go ahead and take all this tape off you. We unhook the feeding and you're not hooked up to suction. All right, Miss Barbara. I just want you to take a deep breath and hold it for me, okay? And I'm going to pull it out nice and slow. 1, 2, 3, deep breath. Just going to pull it on out. All right, and we're going to toss it. You can go into the biohazard. And now I'm going to go ahead and take off these gloves and wash my hands. And I'm going to go document, when I put it in, I would have documented which nair, what size the tubing was, how well she tolerated it, and whatever I hooked it up to, whether it was suction or a feeding pump, or if we did, a bolus feeding. And then now that I've taken it out, I'm just going to document my removal and document her tolerance and let everybody know like what her nairs are looking like now. She did really good. Okay, and I'm going to wash my hands. Thank you.